The Board of Aldermen and I, with extensive research and input from healthcare professionals, have developed a plan that we are calling Serving Oxford Safely, a plan for recovery, phase one, that we met today for about 4.5 hours to discuss and go through. We did find this morning that we have 11 new positive cases, bringing our total number of positive cases of COVID-19 in Lafayette County to 81. Now, I want to explain how we are charting those because you'll hear me talk about our peak. And our peak is not necessarily one day, perhaps it's a couple of days when we see our number of positive cases peak. And we are charting this 3 different ways. Our Emergency Management Director, Jimmy Allgood, is working in close connection with the Department of Health and with other healthcare professionals to look at this number by subtracting out from 15 days after a case is reported, we start subtracting it because we assume at that point, and this is not 100% accurate, but we assume at that point that the person has either gotten well or has passed away after 15 days. And so that way we are looking at our number of active cases rather than just a total of positive cases over a long period of time. We are also analyzing this data by subtracting the number of patients at a long-term care facility that is experiencing positive cases because we know that those citizens are not out and about in the community where they could pass this virus to someone else. So those are the ways that we are analyzing data. As we move forward, we will continue to look at these numbers and analyze those, but we'll also look at circumstances such as the number of people that are hospitalized, those in intensive care and those on a ventilator, so that we are sure that we are looking at this from every angle as we make decisions about moving forward. Today, the Board of Aldermen decided to extend the order that had been in place. We now have a 4th resolution that will allow, beginning at 8 a.m. on April the 30th, non-essential businesses will be able to provide curbside service. Now, 2 weeks after the peak, we will move into phase 1. That's not 2 weeks after April the 30th. That is 2 weeks after the established peak date. Now, in order to determine the peak, we've got to have enough data on the other side showing a decrease in active cases. And so you'll hear us talk about that in the coming days. And we believe that that peak will be this week. And so we will be able to move into phase 1 after that time. Now, this Serving Oxford Safely plan was developed with close coordination with advice from the CDC, from the Department of Homeland Security, from the Mississippi Department of Health. We had a lot of input from local physicians, Dr. Jeff Dennis, Dr. Eric Dahl, and Dr. Jason Waller. I will tell you that, with Oxford having such a diverse population, a population that is made up by a lot of students and young people, and on the other hand, a lot of retirees, there needs to be a plan that's specific for our community. And so our board has been committed to figuring out how to meet our goal, which is for Oxford to be open and ready for business August the 1st. We know from consulting with physicians that that means that we need to really be deliberate and slow about reopening to keep from having another real setback where we have to have another shelter in place. So with that in mind, we asked those physicians, what is the key to success here in reopening? Of course, there's no magic wand, but all 3 physicians said that in order to reopen successfully, 2 things need to happen. You need to continue to socially distance, and you need to wear masks. Now, a common misperception is that you're wearing a mask to protect yourself. You're in fact wearing a mask to protect others. And this virus is so contagious, and there are so many asymptomatic people walking around who are shedding this virus who feel fine, that it's important that everyone wear a mask. We've made that suggestion repeatedly, and those of you who have been out and about have no doubt seen that many people are following that advice and are loving their neighbors by wearing a mask. Another thing that Dr. Dahl said, if you saw the video the other day, was that the mask is the new seatbelt, which I love that analogy, and it truly is because it can save a life. However, the difference would be this. People say enter at your own risk. If you don't wear a seatbelt and you have an accident, that's not really going to affect me. But if you have the coronavirus and are not wearing a mask, that is going to affect me. So your behavior doesn't only affect you, it affects everyone around you. And so we ask you, please wear a mask for your neighbors, for your grandparents, for people that you love, for people that you're going to pass at the grocery store. Please wear a mask. The Board of Aldermen made the prudent and really limited decision to require essential businesses to require their employees and customers to wear masks. Now, essential businesses are those that are places where we all have to go. Okay, it's your grocery stores, your convenience stores, your pharmacies. And so we're asking that people in those businesses, both the employees and the people that visit those businesses, wear a face covering. It does not have to be a mask. It does not have to be any type of medical mask. You can wear a bandana. You can wear a scarf. You can wear any piece of cloth fabric that you can tie that covers your nose and your mouth. And wearing it properly is also very important. Now, we have already heard from people saying, if you're going to require us to wear a mask, where are you giving them out for free? There are many organizations who, in fact, are giving out homemade masks for free, but receiving a mask for free or purchasing a mask is not necessary. You have items around your home that you can use. On a video that Dr. Dahl made with us the other day, he demonstrates, go back and watch it, he demonstrates how to make a mask out of paper towels and 2 rubber bands. So there's really no excuse for saying, I don't have a mask. I understand that they're uncomfortable to wear, but I also understand that for the future of our community, we need you to wear a mask. Now, non-essential businesses and folks going in those businesses are not being required by the City of Oxford to wear a mask, although we encourage it. We encourage any time that you are unable to effectively socially distance yourself from others that you wear a mask. So we ask you to do that. I mentioned our Serving Oxford Safely plan for reopening. We're excited to say that, you know, that light at the end of the tunnel, August 1st, we are headed in that direction. And so this plan that was adopted today that you can see by going to www.oxfordms.net, you'll see it's on the first page, and I believe the button says Serving Oxford Safely, so please go and check it out. It has a statement from the mayor and board, it has projected goals, and then it has the guidelines that each business would follow during phase 1. Now this is only phase 1, okay? So as you read it, keep that in mind. Phase 1 will begin 2 weeks after the peak. And as I said, we have to have some more data before we can determine that peak. But phase 1 doesn't begin 2 weeks from April 30th. It begins 2 weeks from the identified peak. And we will keep you posted as we move towards that date. It is, we're a long way from the finish line. We are, and this community has stepped up to take care of each other, stepped up to support each other, and for that I'm forever grateful. When you see volunteers mowing grass, give them a honk and a wave, because we've had so many people call to say, hey, I want to help. How can I help? We need all of you to take care of your neighbors, to still continue to socially distance. I know there will be questions as you read through this Serving Oxford Safely, so let us know. Call your alderman, send us an email, call my office. We would love to answer your questions as we all are stronger together. Thank you.